glute max or hip external rotation exercise here. All right, so I want you to put one hand on the table, all right, and that just stabilizes you here. The common compensation with a typical clamshell exercise is that your body starts to open up too much. So we're going to preset your hips in such a way where it sort of avoids that from happening. All right, so the first thing you're going to do is just round your body a little bit so your ribs come closer to your waistband. All right, and then you're going to shift the front knee out in front of the bottom knee, and at the same time you're pulling the bottom hip into the socket. The heels will stay together almost like they're glued together. All right, and then what you're going to do is think about this top hip rolling up. So that's external rotation. As soon as I do that, right butt turns on. When I hang out here, I'm going to breathe now. So I want to inhale, allow air into the belly. As I'm doing that, I'm thinking reach this thigh. As I exhale, I want to think breathe into my left lower abs here. Inhale, reach. Exhale, left abs. So you have 5 breaths. You should feel this right outer butt screaming a little bit. You really only have to do this on the right side because that's the knee that's caving in for you a bit. So 5 breaths 5 times there. Okay, and the other one we're doing, you got your progressive hip and knee flexion against the wall with a pelvic tilt. All right, so you start 90-90 with the hips or the knees right over the hips. Shins are going to be parallel to the table. All right, you breathe in. On the exhale, curl up so just the tailbone comes up. You press your heels into the wall and gently pull them down. So that should turn the hamstrings on. And then you're just going to do 5 breaths here. Fill the belly. Exhale. Think ribs drop down. You can use your hands gently to guide. Don't try to force anything though. As long as you're feeling the back of the thighs working, you're doing all right. 5 breaths there, okay? If that feels okay on the knees, you scoot yourself a little bit more forward. All right, now we're in a little bit deeper hip flexion and knee flexion position, and then you're going to do the same thing. Trying to feel it back here. If you feel stuff going on here, then just move back to where you were. So you can sort of assess what you feel you can tolerate. Over time, we want to get you pretty close to the wall and down in here without those heels coming up. All right, and feeling like we're still getting the hamstrings on in a deeper position.